Hello and welcome to The Virus. I'm Jeremy Fernandez. Coming up, we take a look at what the medical profession has learnt 2.5 years into the pandemic. And as the world opens up again, airports and planes are full. So what can you do to mitigate the risks of catching COVID? But first, Australian public health officials went to Israel earlier this month for a high-level exchange on what the world has learnt about COVID treatment and management, including long COVID. Associate Professor Nigel Crawford is the chair of the Australian Technical Advisory Group on Immunisation, better known as ATAGI. He joins us now. Professor, thanks for being here. How comparable is the situation that Israel has seen and Australia has seen up till now?
Thanks for having me, Jeremy. Yeah, I was fortunate enough to join a delegation led by Sharon Lewin and a group called AussieMed to Israel in early September, where we got to sort of share ideas and discussion around the response to the pandemic. And I think there's lots of similarities in how we responded, but also significant differences. And obviously the very first ones, particularly in Australia and New Zealand, was the capacity to close our borders. And that impacted obviously on the first few waves, which Israel, as an example, wasn't able to do. They couldn't shut their borders completely, but did have some variations in response in terms of access to vaccines and other public health measures. But certainly lots of similarities, but also some significant differences.
Israel really led the way, particularly on immunisations. What have we learnt about the way they tackled it versus the way we did?
So I think the key thing for us was their early access to the vaccines. And what they actually did, they had a data agreement with Pfizer, one of the companies that have manufactured the mRNA vaccines, and allowed access to their data, really strong in Israel on both innovation and access to data. So they had early access to the vaccines in December 2020 and rolled them out very rapidly. So they set up structures similar to Australia in terms of hubs and hospitals and everyone administering vaccine and primary care, as we've done in Australia, but did it very rapidly and also captured the data. So this was the first sort of real-world vaccine effectiveness that we were seeing in Israel in terms of how many vaccines were rolled out, what was the impact on the virus, how did that vary as the different strains emerged, particularly over 2021. So that early rollout, access to data, and then publishing it obviously in very high-profile journals such as the New England Journal of Medicine meant that lots of us could see that data and help inform our policies. So I think that was one of the key strengths of Israel's response.
For the purposes of learning how to handle pandemics in the future, did you talk about the things that didn't work very well?
Yeah, it was a little bit of both. So obviously you try and think about the successes that I mentioned in terms of the vaccine rollout, but also some of the difficulties that were faced. And similar to Australia, they had some populations such as the Orthodox Jews and Israeli Arabs who are initially hard to access to the vaccine. There was high disease in those groups, and similar to Australia in some of the culturally and linguistically diverse groups, we know it was harder to access both vaccines. And now we have some of the treatment. So really making sure that there's targeted strategies to approach those important groups. They are often at more risk of severe disease, and some of those outcomes and early access is really crucial. So while there were some issues with providing vaccines to those populations early on, they certainly addressed that and try to overcome it as they rolled through the pandemic response, particularly as I mentioned in 2021.
We've seen the take-up of vaccines here in Australia sort of tapering off. It's gotten weaker and weaker as doses get on. Do you expect that will change because we've learnt how to tackle particular groups and their willingness to take up a vaccine?
I think we have learnt lessons that people will take up the vaccine when we provide good both education and rationale for why we need it. And we're in a different phase of the pandemic now. But a key thing is that we've got to reflect also on the successes. Australia's had a fantastic uptake of over 95% of the vaccine and 16 and over in terms of the primary course. Over 70% have had those boosters, and they're still holding in terms of protection from severe disease, which includes hospitalisation, intensive care and death. So the vaccines are working really well still in protecting from those outcomes, but we're still not quite sure, what may come next. So we need to stand prepared to potentially make some changes to our vaccine recommendations. We know that's happening already in the Northern Hemisphere in Europe and North America, preparing for their northern winter that's soon approaching. So being prepared for what might come next, being open to responding as we need to. We acknowledge there's a little bit of fatigue around COVID and all the things that have happened through the course of the pandemic. But I think having those systems strengthened, being ready to respond as needed is really crucial.
How confident are you that we're at the right settings, right public health settings now, and that the worst of the pandemic is behind us?
So in terms of the worst pandemic, as I alluded to just before, I think definitely we're in a much better place now, not just in terms of the vaccines, which, as I mentioned, I think have done an amazing role in terms of mitigating the impact of the virus, but also the antivirals as well as the monoclonal antibodies. And it's not just producing these medications, it's access. So just giving a bit of a personal story, my father's 83, he'd had 4 vaccine doses, but did get COVID recently, got quick access to the antivirals and has done pretty well in response to the infection. So we're in a different place now in terms of how we can respond, but also at a population level. If we are in enclosed places, if there is a risk of transmission, still appropriate to put on a mask and do some of those mitigation measures. And there may be changes as in January this year when we had the Omicron wave come unexpectedly. We may need to respond in that way. So very hopeful that that's not going to happen, but we also as public health response need to be prepared for that.
Associate Professor Nigel Crawford from Otago, thank you.
Thank you very much.
Japan, Taiwan and Hong Kong have unveiled plans to reopen their borders to international travellers. So that leaves only mainland China and a handful of other countries with COVID-19 entry restrictions. Dr Deb Mills is a specialist in travel medicine and she joins us now. Dr Mills, thanks for joining us again. Things are continuing to open up. How easy is it these days to hop onto a plane or a train and just head overseas?
Gosh, Jeremy, it is much easier than it was before. It was really quite difficult with all the quarantine restrictions and paperwork, so it is easing significantly. If you're vaccinated, it's very easy. If you're unvaccinated, it's still a little bit of trouble in some places. But if people are vaccinated then and they carry their certificates, the Australian one with the little QR code, then it does make life a lot more smooth. There's not the quarantine requirements that there were before. But the trouble is the disease has not gone away. I think the world is just tired of it. And now that everyone's vaccinated, people are thinking, well, there's not much more we can do. We'll just sort of let it open and it's everywhere anyway. So why are we trying to stop it? But on an individual level, it's a completely different kettle of fish. Like you do not want to catch COVID or really any other respiratory disease on your lovely overseas trip. So there are some things that you can do.
I'll get to some of those measures in a moment, but I want to ask you about the paperwork. To what extent is the paperwork burdensome? Where do you get the latest advice? And are digital forms of proof of vaccination accepted universally?
Well, the best place to get the advice is looking at the website of the country you're going to visit and the countries you're going to transit. And I cannot keep these in my head because they keep changing very frequently. In terms of whether it's digital, the trouble is the battery on your phone can die. And so it really is very important to carry paper copies as well, just to minimise the chance of disruption. But for most countries, like getting into New Zealand now, you fill out some paperwork before you leave. For many countries, you might have to say where you're going to be so that they can track you. But most places on the website of the country will have links to what you need and what paperwork you need.
So as you say, the virus is still with us. What can we best do to protect ourselves in those closed environments, particularly in things like planes and trains?
Absolutely. So the first thing is to make sure you are well vaccinated. And the guidelines for vaccination shift around a little bit, but have as many vaccines as you're allowed. And ideally have the last one 3 or 4 weeks before you leave, because then you've got the highest level of antibodies. The second thing is it's a very good idea to wear an N95 mask. Now that's this kind of mask here, as opposed to the surgical mask. These N95 masks are just a little bit more protective, not only against COVID, but against influenza and other respiratory diseases. In fact, you don't want to get any respiratory disease because if you look like you've got COVID, then everybody kind of panics and you become the leper. So it's better to avoid any respiratory illness. And so wearing an N95 mask on the plane as you walk down those tunnels that you get onto the plane, and above all, when you get on the plane, that little round thing above you, which sends the air towards you directly, I would turn that on because you are getting air directly from the filtration system of the plane instead of drifting across from the person next door. There is some evidence that the people in the next 2 or 3 rows could give you COVID, and if they are coughing, then you're basically a sitting duck. And the problem is that many of the restrictions for wearing masks on planes are gone. And so people think, well, no one else is wearing a mask. Should I bother? And the answer, the data says, yes, it is still worth you as a passenger wearing a mask, even if the people around you choose not to.
There is a new vaccine on the horizon. How far away is it, and what difference will it make to a person's risk profile? And is it worth delaying your next dose in order to catch that one?
Yes, well, the new vaccine that's coming is the Moderna bivalent vaccine, which means that it has two bits in the vaccine. It has the ordinary ancestral strain of the virus and the Omicron strain. So it's expected to be available at doctors by around about the 10th or the 12th of October, so very soon. So if you're leaving in the next 2 weeks, no. But if you're leaving in end of November or Christmas and you're going to have a booster, it would make sense to have the bivalent, the new vaccine, rather than the old one. The data is still a bit thin as to whether that makes a massive difference, but the immune system likes a bit of diversity. So having a vaccine which is just slightly different is likely to be much better. And we know that it works well. It's just whether it works better than the original Pfizer and Moderna is something which is a little unclear still. It's likely to.
And just very quickly, if you do get COVID overseas, what are the best avenues to get help?
Look, if you're over 50, and particularly if you're over 60, it would be really nice if we could carry the antiviral drugs with us. The Paxlovid, which is very good, 90% effective at keeping people out of hospital and decreasing symptoms. And Paxlovid is great because it cuts down the number of viruses in the early stage. But the trouble is, in the early stage, you're not very sick. And so people think, oh, do I really need to take this tablet? But by the time you get really sick, the tablet will no longer work. So you have to take it early on. Some of the countries will have this drug available. And so we like to advise our patients, if you do get COVID, try and get this medication. But it is a very useful medication to just decrease the chance of you getting sick. But if you've had your 3 or 4 vaccines, then the chance of you getting sick is going to be much diminished.
Dr. Deb Mills, always good to talk to you. Thank you.
Pleasure.
And before we go, a tribute to a member of our small team here on The Virus, Megan Purcell. She was our editor and had been living with cancer while piecing the show together for us week to week. Sadly, she died earlier this month. She was an ocean of calm and kindness behind the scenes, helping us deliver ABC News programs to you. We extend our thoughts to her family. From us, bye for now.